As a provider, having 24 access to information, quickly documenting a patient encounter, capturing billing codes, and ordering prescriptions and labs are key to running a successful practice and providing quality patient care. Our exciting service enables you to securely access information and finish your work from any location at any time. Our task feature delivers an easy way to communicate with other staff while being alerted to priority issues. Our service requires no upfront investment. We are so confident you will want to use Enabledoc that we offer a 30-day free trial and a low monthly fee. Let me show you how Enabledoc lets you document the patient encounter, code the encounter, order medications, order labs and radiology exams, and finalize the note and charges. You're looking at the provider dashboard. This screen shows you all the pending tasks that you have, in progress notes, and appointments, which can be filtered by different date ranges. Simply click on the patient that you want, and that patient chart will open. Now, once a patient is checked in to your office, your staff is ready to begin the clinical diagnosis and evaluation process. This process will vary from office to office and specialty to specialty, which is why Enabledoc has flexible workflow features such as customizable templates, customizable menus, customizable forms, all that can be designed for your practice. Though we provide a standard set for each specialty, every physician works differently. We've also designed the screen so that from any screen you can access critical information. For example, if I want to find out more about this patient, I simply click here. If I want to find information about more patients, different appointments that I might have, I can locate them here. I can look at different encounters, notes, and my entire patient list, all with a click of a button. I also have access to my tasks, as mentioned before, so I can easily go to a task, go to that page that was linked to it, or create a new task. It's really that simple. Let's just open one just to see. This particular task is for the physician to call the patient. You see here that this task is linked to the patient encounter. There's notes. It's assigned to either a physician group or any specific number of employees. I can establish different priorities, such as a normal, a checkout priority, or a high priority. And I can assign different task types, which are all customizable. And I can track the status as open, working, or complete. This makes it very effective to send messages and communicate tasks and work to your entire organization. And it's available from any screen. Now let's take a look at the documentation process. My nurse has already reviewed the chief complaints, and I have access to all the patient-related information on the chart, which can be updated and viewed in different ways, and I can reorganize this information however I want to view it. As you can see, menus open and closed so that I can view more information easily. If I want to quickly go in and see more detail about the chief complaints, I can view it here. That way I can go through and make any changes that I need to make. I can also view all the detail in the note itself. And if I prefer to, I can actually make changes in the note and type in any information that I want. However, I like to use templates. These templates are completely customizable, and you can add any number of different templates that you like. Templates can be organized into different sections. This is a review of systems, which basically allows me to answer yes or no to any of these questions, and then save it. The lock feature allows me to keep track of work that I've completed. So if I've completed the review of systems, I can now lock it so that I don't have to worry about whether or not I completed that section. Physical exam works the same way. Again, these are completely customizable. You notice here that these are checkboxes. You can also set it up so that you pull forward from prior exams. You can also differentiate between patients based on gender. Getting to the diagnosis section, I have a full knowledge base at my control that I can search through based on different categories and subgroups. I can pull up past diagnoses, past patient diagnoses for this particular patient, and my favorite diagnoses. And I can continue to add to this list whenever I want to. Now, this particular patient has a diagnosis assigned. You notice here I can also assign chronic diagnoses. I can identify location, the type, whether it's primary, chronic, or resolved. I can customize the different conditions and simply update it as I go along. And I have quick access to a complete diagnosis history, should I need to go back and check their entire history. I can then get to the point where I'm going to prescribe a medication. We use a Lexicomp knowledge base to make the process of searching through medications easy and providing all the key information for proper prescription ordering at your fingertips. Again, we provide past patient, and favorite medications. You can organize by brand or generic. You can search through the entire knowledge base, and you can also select medications based on conditions. We identify if it's over-the-counter or prescription medication, and provide a quick way to identify the CSI level. You can also just type the name of a medication if you like. It then automatically assigns to today's diagnosis, or would allow you to select a particular diagnosis. It intelligently identifies the dose, routing form, though you can make changes to these as you see fit. Again, all the information is easily accessible at your fingertips, as well as any drug allergy and other allergy are easily displayed here, along with the weight and BSA. If the patient is pregnant or breastfeeding, we also display that information here as well. And when there's a drug dosage interaction, this is just identifying here that that the amount is out of range. We also do drug allergy, drug condition, drug-drug, drug food, but you can always override any drug screening that comes up. And then I can electronically send it over the SureScripts network, print it, or if I want to just save it for now and come back to it, I can come back at any time. Orders works the same way. There's a simple knowledge base of lab, radiology orders that allows you to search for them based on category, past services, past patient services, order sets which you can establish yourself, and favorites. We make the entire process very easy to do. And then all the information appears in the superbill. I can easily add E&M codes, CPT codes, or if I've administered medication, I can add those to the charges as well. If a charge is not entered, I can easily add it. It's just that simple. When I'm done, all I need to do is finalize it, and all the charges go over to our billing software for easily processing of claims. Thank you very much.